Hello, my name's Adrian Bauman, and I'm going to give you a short history of the Prevention Research Collaboration. The history of the PRC goes back 20 years and really is something I've been involved with closely for all of that time. It started in the early 2000s when I ran the New South Wales Centre for Physical Activity and Health based at the University of New South Wales, and there was a developing New South Wales Centre for Public Health Nutrition at Sydney University, and also I was on one of the directors of the Australian Centre for Health Promotion at Sydney University, and we decided to try and bring this expertise together around non-communicable disease prevention with a focus on research and informing practice and policy. So in 2004, the physical activity group moved into Sydney University. We were based in the Medical Foundation building and co-located with the Centre for Public Health Nutrition. We gradually became the New South Wales Centre for Overweight and Obesity because of policy directions from New South Wales Health at the time. And that evolved into the Prevention Research Collaboration as we've known it for more than the last decade. The Australian Centre for Health Promotion faded during this time because Don Nutbeam went back to the UK and Marilyn Wise went to the University of New South Wales. But the values of the Australian Centre for Health Promotion were very much incorporated into the Prevention Research Collaboration. The PRC really sought to achieve excellence and relevance in a number of areas, and they are still current today. Really, the goals of the PRC were to do public health research on chronic disease, including physical activity, nutrition, obesity, and tobacco, to do applied public health research that would inform the system, including monitoring trends, building surveillance measures, doing research translation, and doing dissemination research at the population level, understanding whether community-wide programs worked or not. Doing technical and policy-relevant research for government, for non-government, and for international agencies, and developing research methods for program evaluation at scale. The attributes of the PRC also are similar to those that we developed 20 years ago. The concept and philosophy of collegiality and interactions across the group, the principle of multidisciplinarity. We came from many different backgrounds, but mostly had public health training and a strong public health focus. Many of our senior staff had previous public sector experience, and past staff members that fitted this category were Leslie King, Bill Bellew, Blythe O'Hara. We had a strong commitment to public health values and to research that focused on equity. We did a lot of teaching and training, both within the School of Public Health in the MPH and University of Sydney programs, but also externally in capacity building through short courses for the Ministry of Health and others, in fact, short courses internationally around physical activity and also around obesity prevention. Our structure is we live within the Faculty of Medicine. That's where we were born. It's now Faculty of Medicine and Health, within the School of Public Health, and the PRC was within and has remained within the School of Public Health. We built our own research program. We evolved and joined the Charles Perkins Centre about 8 years ago, which was a wonderful experiment that actually catalyzed many of our interactions through the CPC, and we became a WHO collaborating centre. We've always used a Janus model. Janus was the Greek god with two heads, and one of our heads was facing government and NGOs that did policy-relevant work, did co-creation, and used systems approaches. The other head was facing the NH and MRC, getting traditional research grants, evidence generation, research publication, and academic kudos. And we managed to maintain this two-headed approach throughout the lifespan of the PRC. On the 25th of July, 2013, we were launched as a WHO collaborating center around physical activity, nutrition, and obesity. I was co-director of that, and my colleague Stephen Colliguri from the Bowden collaboration was the other director. Now we have many members of the PRC on our executive running the WHO Center and doing work in many different areas. Other things that happened apart from joining the Charles Perkins Center, having other external partners, we've done quite a lot of work with the Bowden Institute, now the Bowden Collaboration, and it's our partnerships with groups that have also strengthened not only the way we work, but strengthened our partners as well. And in this shared history, I think is one of the strengths of the PRC. What kinds of things have we done in recent years? Things like build the evaluation structure for the New South Wales Ministry of Health Get Healthy program, building the Sprinter Group, a collaboration with the New South Wales Office of Sport and also with Sport Australia. Very strong linkages with the Australian Prevention Partnership Centre over the past decade, and a very good track record in conducting several iterative New South Wales physical activity and nutrition surveys, the SPAN surveys in New South Wales primary and secondary schools, a representative random sample survey, including device-based measures. What does the future hold? It's very difficult to predict the future, and the face of prevention is definitely changing globally. Within Sydney University, prevention is no longer confined to the PRC, so it's not as unique as it once was. There are prevention groups now in several parts of the Faculty of Medicine and Health, and in fact outside of the School of Public Health as well. Prevention has been strongly influenced by COVID-19, climate change, and the changing economic conditions that make equity-focused public health work all that much more difficult. I do think there will be greater attention to the policy relevance of research, which positions PRC well. There'll be more use of systems approaches, and there'll be interest in methods for scaling up interventions to reach the population and evaluation methods to understand that. That's really all that I wanted to share with you today. I wish the meeting very well today, and it's been a pleasure and a privilege to lead the wonderful group of people that have characterized the PRC over the past 20 years.